Hello, uncles, aunts, brothers, sisters, and dear seniors. I'm Dr. Sarah Bennett. For more than 20 years working with older adults, I've listened to, walked alongside, and witnessed many stories that sometimes begin with things that seem very small. Today, I want to share one such story, a story that starts with a nose. It was a late autumn afternoon when a man in his 70s came to my clinic. He had no fever, no cough, no sneezing. Yet his eyes were full of worry as he said, "Doctor, I can't smell the coffee every morning anymore, or the pastries my wife always bakes. The smell's gone." I sat silent for a few seconds because I know that sometimes our bodies don't shout, they only whisper. And the sense of smell, that seemingly tiny abilities, one of the first whispers the brain sends when something isn't right. I still remember that day clearly. After an exam and some imaging tests, we discovered that the area of his brain related to memory had already begun to change. Without his own attentiveness and sensitivity, that process might have quietly continued. So today I invite you to listen closely with me. Is losing your sense of smell just a small matter, or the brain's first warning bell? Before diving into that, let's pause for a moment to look back. What exactly is the sense of smell, and why is it so important? Sense of smell, the brain's small doorway. Dear friends, if we ask which sense is most often forgotten in daily life, it is probably smell. We usually pay attention to our eyes to see clearly, our ears to hear clearly, or our arms and legs to move and grasp. But what about smell? It works quietly, gently, without making noise. And yet, few people know that smell is one of the first gateways leading to the most important center of the brain, the regions of memory and emotion. When you smell fresh-baked bread, a slice of lemon, or morning coffee, it's not just a pleasant experience, it's a journey. Tiny odor molecules enter the nose, touch the olfactory nerve, and immediately send signals straight to the limbic system, the place that governs memory, emotion, and instinctive reaction. No middleman, no detour. Directly to the center of memory, the hippocampus. That's why a single scent can pull an entire field of memories back. Like when you catch the old soap scent of your mother, or the smell of earth after rain in your childhood. It's not just a smell, it's memory coming alive. Therefore, when the sense of smell suddenly disappears, it's not from a cold or a stuffy nose that's no longer a small matter. It's like a longtime friend who suddenly stops calling or dropping by. Strange and worrisome. I often tell patients that smell is like a tiny bell hanging at the front door. When a stranger lingers around the house, that bell rings first. If we listen carefully, we can check in time. But if we don't pay attention, that stranger may have already stepped inside. Unfortunately, many people ignore that bell. They think, it's probably just aging. What's the big deal about losing smell? But that complacency lets serious diseases quietly develop, gradually affecting memory, alertness, even a person's very personality. I once met a man in his early 60s, still working, still healthy. He came to see me only because he couldn't smell his wife's perfume. At first he laughed it off, thinking his nose had just gotten weaker with age. But when we looked deeper, I found early signs of neurodegeneration in the frontal brain, something no one expected. So, if one morning you can no longer sense the familiar smells around you, please don't brush it aside. Just as chest pain makes us think of the heart, or unsteady walking makes us think of bones and joints when smell changes, we need to think of the brain. It's not simply can't smell. It might be the very first, gentle yet meaningful signal from a brain trying to speak up. And the miracle is, if we listen early, we can change the entire journey. Warning from sudden loss of smell. Dear aunts and uncles, when we talk about the sense of smell as the brain's first warning bell, a sudden loss of smell is like that bell being silenced without warning. It's no longer a gentle change. It's a strong sing-alone we need to take seriously. In medicine, sudden loss of smell can be the earliest sign of several serious neurological conditions that patients themselves often don't expect. One of the most important warnings is early-stage Alzheimer's disease. Long before clear signs like forgetfulness or confusion appear, many people have already experienced loss of smell without realizing it was the first symptom. And it's not just Alzheimer's. Parkinson's disease, a movement disorder affecting millions of older adults, often begins with a fading sense of smell. The remarkable thing is that this happens very early, even before hand tremors or muscle stiffness show up. Like a soft shadow settling in, the sense of smell slips away before anyone notices. I've also seen many cases where loss of smell came from head injuries, fall in the bathroom that seemed minor, or a light bump while cleaning. The front part of the skull, where the olfactory nerve and emotional centers sit, is very sensitive to trauma. In rare but serious situations, loss of smell can be the first sign of frontal lobe tumors that grow quietly without pain. I still remember one patient, Mr. James, 68. He came in for a single reason: I can't smell my wife's cooking at dinner anymore. At first he thought it was normal. But his wife insisted, so he came. After testing, we found early damage in the frontal brain areas tied to memory and cognition. Because it was detected early, he received timely treatment and kept his quality of life and precious clarity in old age. You should also watch for symptoms that come with loss of smell. If you've recently been forgetful, mixing up dates, unsure where you are, or sometimes feeling sad, depressed, or emotionally off for no clear reason, don't brush it aside. These could be tiny links in a chain of warnings from the brain. And sometimes, it all begins with one morning when you no longer smell that familiar coffee. So listen carefully. In medicine, small symptoms, noticed at the right moment, can save an entire life. How is the brain affected? When we talk about loss of smell as a warning from the brain, many people ask me, "Doctor, what's the connection? It's just losing a senthou can that affect memory." The answer is, it affects it a lot, and it may even be one of the very first effects. To understand this, we need to look at a very small but vital part of the brain, the olfactory bulb. This is the brain's first stop for signals from the nose when you smell something. What's important is that the olfactory bulb doesn't work alone. It connects directly to the hippocampus, the center that controls human memory and learning. That means every time you smell something familiar, the olfactory bulb not only identifies the odor, but also wakes up the hippocampus. That's why a scent can bring back an old memory, like your mother's scented powder or the smell of new books on the first day of school. Smell and memory. Olfaction and recall always walk hand in hand, quietly yet deeply. Here's the issue. When neurodegeneration sets in, as in Alzheimer's or Parkinson's, the olfactory region is often the first area hit. Like a silent breeze, damage begins in the olfactory bulb, then slowly spreads to the hippocampus, affecting memory, orientation, and even emotion. Picture the brain as a vast garden, where the olfactory region is the entrance and the hippocampus is the central house filled with memories. When the entrance starts to rot, the damage doesn't stop there. It spreads to every corner, every tree, every brick of memory. If not caught early, that house your memories can fade like an old blurred photo. One more point to note. Because the olfactory region lies right beneath the frontal lobe area that governs emotion and behavior, when it's affected, you might feel sad for no reason, irritable, or withdraw from social connections. Those changes, seemingly psychological, actually start with microscopic damage in the brain. I know hearing this might make some of you anxious, but believe me, knowledge and attention to the first signs is the key to protecting the brain. We can't stop time, but we can slow down what's happening inside if we listen early. And the first step in listening is paying attention to smell. That little nose turns out to be the loyal gatekeeper of our memories and emotions throughout life. How to check and detect early. After understanding the connection between the sense of smell and the brain, you may wonder, if I or a loved one loses their sense of smell, how do I know whether it's normal or something to worry about? Today, I want to show you some very simple ways to check and detect early right at home. First, You can test your sense of smell every week like a light routine, just as you would check blood pressure or weight. No complicated medical devices are needed, only familiar household items. A freshly brewed cup of coffee, a slice of fresh lemon, a little essential oil such as peppermint or lavender, or cinnamon or vanilla powder. Simply close your eyes, take a gentle, deep breath, and see whether you still recognize that familiar scent. If you must concentrate hard to perceive either or can't smell anything at all, note it down and keep monitoring over the next few days. So when should you see a doctor? If loss of smell lasts more than 1 week and is not accompanied by a cold, nasal congestion, or allergies, it's no longer a small matter. Especially if it comes with other signs like forgetfulness, disorientation, or mood changes for no clear reason, you should visit a neurology or ENT specialist as soon as possible. Today, checking the cause of smell loss is no longer overly complicated. A few simple tests like a brain MRI to view the olfactory region or gentle neurological and memory assessments can help doctors detect early changes invisible to the naked eye. Many people hear MRI and worry about cost or complexity, but in reality, detecting neurological disease early greatly reduces later treatment expenses and the risk of losing quality of life. It's an investment in yourself for peaceful, lucid years ahead. I always tell my patients, if one day you suddenly lose your sense of smell, especially without having a cold, please don't be complacent. Pause, listen to your body, and don't delay. Our bodies always find ways to send signals. The question is, are we willing to listen? Early detection doesn't require panic or anxiety. It only needs a bit of regular attention, a bit of self-understanding, and a bit of courage to see a doctor when necessary. That is the gift you can give to your memory and brain health today and in the future. Caring for the brain in old age. By now, we've realized that the health of the sense of smell isn't just about the nose. It concerns a delicate system inside the brain. So, as we enter old age, how can we actively care for and nurture error in message stream? Dear aunts and uncles, we've just taken a journey together from a seemingly small symptom, loss of smell, to very deep matters inside the brain. I know that after listening, some of you may feel a bit worried. But please don't let that worry settle into fear. Let it become motivation to observe your body more closely and love yourself a little more each day. I've always believed our bodies are loyal friends. They never stay silent without reason. Every small change has its cause. And before crying for help, they usually whisper like the sense of smell speaking up first. If tomorrow morning you wake up and notice coffee doesn't smell as rich as usual, please don't brush it off. Pay attention, listen, and if needed, don't hesitate to see a doctor. One early step today can preserve an entire realm of memories tomorrow. If this video gives you some insight, a bit of peace, or a spark of motivation to care for yourself, please share it with friends and family. Who knows, it might help someone else listen to their body in time. And if you find what I share meaningful, please hit the subscribe button. We'll meet again in many other stories, gentle, familiar, and full of trust like this. Wishing you always good health, steadiness, and the light of memory in every day you live. I'm Dr. Sarah Bennett. See you in the next video.